Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. If you want to know why your healthcare isn't what you thought it would be, why you are not getting healthcare, why your medical interactions are not going according to plan, look no further than what has happened to academic medicine. Our institutions, our healthcare leaders who are academic doctors are completely ideologically captured, and this is to the detriment of the health and well-being of the population. Now, I'm always very aware when I make these videos that I don't want to appear like I'm being very negative, like I'm always whinging all the time, because I don't think I'm naturally that type of person. If you were to ask, I'm sure, at least I hope, the people closest to me in my life, they would say that I'm definitely an optimist, a glass half full type of person. But the reason why I make these videos which focus on the negatives is that this is something that I feel so passionate about, that our healthcare system and our leadership in particular is failing people every day. I am passionate about people receiving the best possible healthcare, and that is not going to happen while we have our current crop of leaders in place. Look no further than the New England Journal of Medicine. Now, for decades, this was thought of as the premier medical journal. People used to look up to it. I remember looking up to it in medical school. I'm not sure why I did. It took a while for my eyes to be open, but things have probably got a lot worse since then. If we want to talk about historical corruption, the New England Journal of Medicine has been involved in a lot of shady things over the last few decades. Back in the 1960s, they promoted a paper which demonized saturated fats and almost gave a free pass to sugar, and that resulted in a health catastrophe. Over the years, they have led many movements according to their published research, supposedly good research, which has turned out not to be good at all for the health and well-being of the population. And during the pandemic, they were the paper that initially published those supposed miraculous results of these shots. And we all saw what happened after that when people jumped on board the studies. And of course, there were a lot of questions over the study results and the actual true benefits. But the New England Journal of Medicine has been absolutely pivotal in a lot of medical news and developments over the last few decades. And I want to share with you their website so you can understand that the top medical journal in the world and the people that edit it, the people who regularly write and oversee it, are not thinking about the real health and well-being of the population and how we truly improve healthcare. The New England Journal of Medicine. Actually, as somebody who grew up in England, I was born in London, grew up in England, I think calling it the New England Journal of Medicine is actually an insult to England. But take a look at this. This is the front page of their website. So here we go, the New England Journal of Medicine. And of course, their website is absolutely littered with pharma ads, including Ozempic. And you go to the top here, look, topics right there. So these are the main topics that the New England Journal of Medicine wants to cover. Let's go down them. So here we have everything listed in alphabetical order under the topics in the New England Journal of Medicine. I'm going to go through all of these. So we have AI in medicine. Then we have climate crisis and health. Well, look at that. The climate crisis is of great concern to the New England Journal of Medicine, thinking that they can really influence the climate of the Earth, which has been changing for billions of years, rather than focus on what they should be focusing on, which is improving healthcare. But that seems to be very important to them, and they regularly publish articles on the climate crisis. Then let's go down. Coronavirus, they've still got that listed there, years after the pandemic. Then efforts toward equity. Ah, yes, equity. Well, I thought the United States was actually founded on equality. Equity is something actually very different. But the New England Journal of Medicine is all in on equity. Then we have firearm injury prevention. That's fair enough. Then we have fundamentals of health law. Okay. Fundamentals of medical ethics. Then we have gray matters, health policy, medicine and society, nutrition in medicine. By the way, their nutrition in medicine section is a complete and utter joke. As a doctor who focuses on metabolic health, the people who are writing articles for the New England Journal of Medicine clearly know nothing about good nutrition. And in fact, my main concern is that if that section ever expands, it is going to be completely bought and paid for by big food. Then we have race and medicine. Then we have recognizing historical injustices and the journal. Well, historical injustices, as bad as they are, have existed since cavemen days. There's no no way around historical injustices. But why really focus on historical injustices when there are so many injustices today on the healthcare that people are receiving? Then let's click on review all topics, and they've got lots of other topics under the alphabetical letter. But my point is this: the people who publish the New England Journal of Medicine are not stupid, at least academically. They are not stupid. They all have degrees. Many of them have medical degrees. So when you click on topics on a subject as important as the health and well-being of the nation, and an entity that sees itself as the top medical journal, take a look again at all of the ones that I just went through right here, from AI in medicine, climate crisis in health, all the way down to race in medicine and recognizing historical injustices and the journal. Take a look at that screenshot. So let's think about this for a moment. All of the crises when it comes to the health of the nation, from the metabolic health catastrophe, soaring rates of diabetes, other inflammatory diseases, heart disease, because we have such a terrible food environment and we have such a terrible cultural environment as well. From people not being able to access healthcare. I mean, how many of you listening struggle to find a primary care doctor? You can't even find a GP to go to regularly and get some basic follow-up primary care. All of those issues going on, not to mention the costs of medicine in the United States going through the roof. Many people are bankrupted, and those are the main topics. When you click on the drop down, those are the main topics that the New England Journal of Medicine has in mind. So I say to you, if you're dissatisfied with your healthcare, which I assume most people are, there's very few people who are extremely satisfied with their healthcare in many countries, whether we're talking about the United States or United Kingdom. Look no further than the people in charge, because the world of health and medicine currently, and very unfortunately, is led by academic physicians and medical journals. They call all of these shots. They really set the supposed standard. They set all of the guidelines and the protocols, and look at what their priorities are. So is it any wonder that healthcare is a complete and utter disaster? Until we change this, until we get sensible doctors in charge, common sense doctors who actually want to focus on real problems, I'm afraid things are going to keep getting worse. So you are better off, and this is always my message, take your health into your own hands. Think outside the box as much as you can. And remember that the best thing you can do for your health is take charge of your lifestyle. Make sure you avoid all of the junk processed food around you, which is invariably 80 to 90% of the grocery store. Make sure you move as much as possible. Don't be sedentary. Engage in some strength training. Work on any stress in your life. Sleep enough every night. Try to stay as relaxed as possible. Have good social connections. I know many of these are not things that lots of people can change overnight, but remember that the best thing you can do for your health is not rely on authorities, not rely on the medical journals, and certainly don't think that doctors or even the government are coming to save you. You are in charge, and there is complete and utter clownery all around us. Thanks everyone for watching. Dr. Suneel Dhand. Feel free to let me know your thoughts down below. Check the links in the description down below for my website, the other work I do, and if you haven't already subscribed for my free newsletter, please do so. We have a lot of fun with our newsletter. Hit the like button if you like this video and the subscribe button for more similar videos in the future. We will speak again very soon.